Okay, so I'm going to talk about endometriosis and infertility, and those of you that consider immigrating, that's 3 hours drive from here, and there are some more pictures from this trip. So if you go to Australia, then it's 12 hours flight and then 3 hours drive, so we have a beautiful country. So what are the issues with endometriosis and infertility? Issues of pain, infertility, and can you have both? Yes, you can have both. What if you only have one? And what if you didn't know that you have endometriosis? Because you must remember all the articles in Europe. In Europe, you can either be a fertility specialist or a laparoscopic surgeon. You're not allowed to be both. So if you're a fertility specialist, if you have a hammer, everything looks like a nail. So if you're a fertility specialist, you only do an IVF. And if you're a laparoscopic surgeon, you only do surgery. We have the privilege that we can actually do both. So it's not a either or. It's an individualized thing that we need to look at. So, and I have a patient on the renal transplant list that's lost both her kidneys because the endometriosis was missing. So we fix the obstruction and we repair the ureter. This patient went to a fertility clinic, luckily not in our province, but a distant province. You have to fly there. And she presented there with pain and infertility. So the treatment was fertility treatment, and she was pregnant. And she came to me with a 4-month-old baby and said to me, and she was standing. And I said, why are you standing? She said, I can't sit, it's too sore. That chronic constipation, the inside of that bowel is supposed to be pink. That is brown because it's colored brown because of the chronic constipation. There's endometriosis in the bowel. This is where it infiltrates nerves. So next to the bowel, those are the nerves that actually supply the bladder. So if we do these surgeries, then sometimes the patients struggle to pass urine afterwards because those nerves are infiltrated. That's endometriosis inside the vagina. So how that leads to infertility is it's too painful to have sex, because there's endometriosis in the vagina. That is endometriosis on the diaphragm, so these are the patients that come to us complaining of shoulder pain when they have their periods. That is where an ovary is stretched because of endometriosis. And that's sometimes where the endometriosis is behind that one ligament on the left-hand side. It looks like a perfectly normal pelvis, but that endometriosis went into the bowel. So that's, if you photograph the stars in South Africa to the South Pole, that's how the stars turn. I'll show you a picture how the stars turn if you photograph that exact same baobab towards the North Pole. So what are the type of surgeries we require for endometriosis? Always excisional. We do not burn endometriosis and we do not laser endometriosis. 2 swear words. Never do open surgery for endometriosis. So if the doctor says to you that he needs to do open surgery, then you request a second opinion. Do not have the cyst wall removed if you want to conceive. That is the big thing we struggle with. People go in, they take out that endometriosis in the ovary, and then we get the patient and she's got no eggs left. So if you have endometriosis, then you need to only drain the endometrioma and do not remove the cyst wall of the ovary. Not laser coagulation, because the recurrence is higher and the risks are higher and disease is left behind. So the black spot you would think is endometriosis, but as I pull on that, you can see that that whole area, and that's why we talk about the tip of the iceberg. So if we can dissect into fat, then we know beneath the disease, that's the nodule that we've resected. The projector is horrible. So how does endometriosis cause infertility? Our biggest fertility nightmare, adenomyosis, so that's endometriosis inside the uterus. We need to suppress that. We can't operate it. The surgery for that is called hysterectomy, and that's not ideal in patients that want to fall pregnant. You can get a single cystic endometriosis inside the wall of the uterus, very close to the lining. That needs to be removed. Vaginal endometriosis, because sex is too painful. Blockage of the tubes, I showed you a picture. And then ovarian endometriosis, If there are no follicles visible after surgery, that's where the problem comes in. And endometriosis causes a hostile pelvis. It doesn't matter how you want to put it, it interferes with everything. So it's not ideal.